lifestyle habit. So we're going to start here, and it looks like, oh my gosh, buddy, you get 2 servings of fruits and vegetables a day. So you like fruits and vegetables? Yes, I do. And mom says, yeah, he's not a picky eater at all. He'll really eat anything I put in front of him. Then we go down to the next question about how many servings of whole grains. And I say, oh goodness, it looks like you don't eat any whole grains. Tell me about that. And they say, well, I've always had white bread, and that's always what we've eaten. And we did try wheat bread and nobody liked it, so I never bought it again. How many times do you eat dinner at the table with the family? And this family said 3 to 4 times, just pretty good. How many times a week do you eat breakfast? 1 to 2 times. And as soon as I say that, mom chimes in and says he's never been a breakfast eater. He ate breakfast when he was a toddler, and that's been it. The next question, how many times a week do you eat takeout or fast food? And I say, 5 or 6 times. Again, mom chimes in before I even can say anything and says, well, his dad's retired and he's home, and the boys are ready to eat as soon as I walk in the door. I mean, it's almost like I can't get my foot in the door and they're asking me what's for dinner. And I've been at work all day and I'm exhausted and they're starving. So I often, and to be honest, once I started driving through and bringing stuff home, it was so much easier that it just really became our new family routine. And I am having a hard time breaking that habit, but I do want to. How much screen time do you have a day? 6 hours. He used to be a very active kid. And now he's not playing sports or football. It's out of the season. And he spends his time on his phone and TV. And Dad says, and if we let him, that would be every waking hour. We have to really get on him. And it's a struggle in our house for us to limit him to 6 hours. He does have a TV in his bedroom. He sleeps 7 to 8 hours each night. We'll talk about that in the review of systems. And he does get about 30 minutes to 1 hour of physical activity every day. We got a lot more during football and less now. As far as how many sugar beverages they drink, he drinks 1 grape juice a day at school. He has 3 servings of water a day, 1 water bottle at home in the evening, and usually 1 cup of water at school. He doesn't really regularly drink Gatorade, except when he's playing football, and he'll have 1 or 2 because mom always takes him 1 for football practice or game. And then he usually always has 1 at the game because the game mom brings 1. No sugar-free drinks. He doesn't drink milk. He's always been intolerant to milk ever since he was a baby. No diet soda. They don't believe in that because they think that's worse than drinking regular soda. So he'll have 1 to 2 cans of pop a day. And he does have sweet tea when he's at his grandparents' house, but that's not too often. On the very bottom of the 5210, as you know, it asks, based on your answer, is there one thing that you would like help changing now? And of course, like everybody else, they filled out 4 things. And the 4 things they would like to work on is eat more often as a family at the table, eat less fast food and takeout, be more active and get more exercise, and cut down on that 6 hours of screen time. Okay, so that's his 5210 questionnaire. I'm going to stop there and have you guys put in the chat what is the first, and then we'll finish his history. But just while we're here and while the 5210 is fresh in your mind, what are the concerning things on the 5210 from your standpoint? Give me 1 or 2 things that you think that you would address. And again, you can raise your hand and Miranda will open it up for you. So come on, don't be shy, guys. Okay. Holly said fast food. Yes, 5 to 6 times a week. That is a lot. Renee Winning said drinks. Absolutely, because he's getting in football season 1, 2, 3, 4, 5, up to 6 sugary drinks a day. That's pretty significant for a 12-year-old. And there's my dog. Quiet. Quiet. Quiet.
So we also have lack of whole grains,
Lack of activity.
physical activity, screen time. Yeah, I think that's everything. Fast food, screen time, sugary drinks, and lack of physical activity.
Okay, so all of those are awesome. If anybody has ever heard me train, the very first thing that I'm going to work on is what? Miranda, what's the very first thing I always
Sugary
work on?
drinks.
Sugary drinks. My favorite thing to say is to the families, guys, I could have Oprah Winfrey Chef come to your house and a physical trainer move in with you. But if you're still drinking sugary drinks for a 12-year-old, all of those things aren't going to make a difference like the sugary drinks. So let's proceed with the
and what is the reason that you focus on the sugary drinks with kids first? Another reason different from what you just said.
Well, why do I focus on? Because all those things are important, right? The biggest reason is because the majority of what I'm seeing in my practice is related to insulin resistance, and sugary drinks is like throwing fuel on the fire. And will definitely remind me to come back to that when we talk about insulin resistance between the cases, Miranda.
Right. And I remember you saying too, that that's where you're going to notice the biggest change. So that encourages them when they see that change, stopping the sugary drinks, that motivates them to continue to make other changes.
Right. The only time I don't start with that is if they start crying when I tell them that we're going to work on sugary drinks, because that means they're not ready. And the first goal we set, we do want it to be attainable for them. We do want them to have a win under their belt early on, okay? Because that really makes a difference for their future success. Okay, so this was his growth chart. Now, I analyze growth charts probably more than anybody. So I first want you to look at his height, because this is what I do. Can you all see my cursor? Can you see my cursor, Miranda?
No. Oh, yeah. Yes. Yes.
Okay.
Yep.
So I'm now, my cursor's on the height chart. So the first thing I do is say, I have your growth charts from your PCP. So let's look at these and how he's growing. And on his height, I see, I'm going to orient you to the curve, and you see down here at the bottom, now I lost my cursor. You see down here at the bottom, that is the age from 2 to 20, and on here is the inches. This is a growth chart. So if I line up everybody in your class, the shortest kids are going to be down at the bottom, and the tallest kids are at the top. And I see here that you're plotting out on the top, so I bet you're one of the tallest kids in your class. And he's growing perfectly. He is following his height chart perfectly. And that is because growth is predictable. So now let's look at your weight chart. Same thing, age going across here, all the way across, the weight going up on this scale. And let's look at how you grew with your weight. So from the age of 3 to 7, it looks like you followed your weight chart just like your height chart. You were on the 97th percentile and completely on the line. But it looks like something happened at 8, which is probably why I circled it in the office visit and I copied this from my chart. So something happened at 8. And then instead of growing parallel to the chart, it looks like you continue to grow more than you should at each time. And that's, so what you want to know at this point in time, it's a no-brainer, right? What happened at 8 years old? Well, what happened is that he had always stayed with the grandparents before, which is usually opposite. Usually the problem is when they start staying with the grandparents. In his case, he always stayed with the grandparents because mom and dad both worked. Dad retired from the mines and started picking him up from school and drove through Wendy's every day. And his after school snack was a Wendy's burger and large fries. That was his after school snack. That's also when he started drinking Coke. They had really never had it in the home before. And this is when he would get a burger, a single, large fry, and a Coke. And he even knew the number from the menu, like what number it was. And that's what he got every day after school. So I really thought by looking at his height and weight that our problem was at 8 when he started gaining weight. But the body mass index, which is the curve below, tells us a different story, because it actually tells us that he had escalation of his BMI starting at the age of 3. So really, if he was in primary care practice, we wouldn't wait until 8 to do something. If we were following his BMI, really, what age is it that we really should have been talking about these health habits? And that's probably different from everybody, but I would think that it was going to be sometime either at the 5-year checkup or the 7-year checkup, when the BMI had gone from being at the 50th percentile and now it was above the chart. Hindsight is 20/20, right? So it always is like, it's easier to look back and say, oh, I should have talked about it here. But definitely the BMI tells us another story. That's a clue. And I often will get growth charts from primary care offices that includes the height and the weight, but not the BMI. And that's why I have my nurse call and get the BMI. And I probably drive you all crazy, and I'm sorry, but this is a perfect example of why that's important. Okay. Any questions before I go on to the rest of his physical? And it looks like I need to step it up, Miranda. Am I going to be able to talk about insulin resistance in part 2?
It's okay. Yeah, you're fine.
Okay.
Good.
All right.
Okay.
Like she's going to tell me no, right, guys? Okay. So let's go on. Miranda, were there any questions? Any hands up?
No, I don't see any questions, which I was going to say, just in case you guys don't know, the way to raise your hand is in the reaction, the same place. That's where you'll find that option to raise your hand if you have a question. And you can also put it in the chat.
Okay.
All right, so are you going to show us his labs next? Oh, no, okay, we're going to
labs, Miranda? Is labs what comes next?
Oh, that's right. No,
we have to finish history. So his past medical history really was just positive for allergies. He had just seen an allergist, had some labs done, and started allergy shots, and his life was much better because he was not having as many symptoms and sleeping better. His review of systems constitutional consisted of a 37 weight gain since his last checkup, which was 2 years ago. He's always hungry. He never gets full. They call him the trash compactor in his the drainage thing, not the trash compactor, but the
garbage disposal.
The garbage disposal. They call him the garbage disposal in the house because he would eat his plate, his second plate, and then finish mom and dad's plates. He did have some insomnia, which mom had been given melatonin, and that seemed to be better. She really thinks the biggest difference was where he got his allergic rhinitis, which is spelled incorrectly, sorry. And his snoring was also better, and he was sleeping better. There was no history of polyuria polydipsia. He did have nocturnia, but it was intermittent and not a consistent thing. He did have anxiety. He was definitely a worrier, and he worried about everything. He was hard on himself with his grades. He was a straight A student, but really even stressed when he got a lower A and not the higher A, or didn't get the best grade in the class. The rest of his review system is normal, and his birth history was unremarkable. Oh, let me go back before I show you the labs. Let me tell you his physical exam. His physical exam, first, his hunger vital sign on the 2 screening question was never true to both. So there was no history of food insecurity. His physical exam, his blood pressure was 119/73. Normal, pulse 92, normal. He was 162.56, which was at the 98th percentile. He was 88.59 kilograms, and his BMI was 33.52, which was at the 99.5 percentile. So on a regular chart, it would have been off the chart, just had a little red arrow pointing up. So we calculated his BMI of the 95th percentile, and he was at 136%. That had greatly increased over the past several years, like we talked about. Now, when I saw him, mom said he had labs. Mom said he had labs at the allergist office. We got a hold of those labs, and it was like a CBC and a nasal smear and CMP, which was the CMP at the allergist office was normal. We called the PCP because mom had said he had had labs there and she was always told they were normal. However, that included thyroid and it never included a fasting lipid profile, and he had never had an A1C done. So when I saw him, I actually did not have labs. I ended up having to follow up with the allergist, with the PCP, calling mom, getting to order labs and have them done. So these labs were done at the second visit, but they consisted of a normal CMP, except the fasting blood sugar was elevated. His total cholesterol and LDL were normal. His triglycerides were mildly elevated at 142, but his HDL was normal at 49. And I know you guys know why we look at that and why I separate total cholesterol and LDL, because this is looking at our looking for hypercholesterolemia. This one is the triglycerides and HDL is looking for metabolic syndrome, which is associated with insulin resistance. His hemoglobin A1C was 5.9, and I couldn't believe it because he really didn't have any symptoms of prediabetes other than the nocturnia, but it had been that way. It was intermittent. It hadn't increased. There was no polyuria polydipsia. Oh, I didn't finish exam. I'm sorry, guys. Let me back up to exam. My bad. He did have postnasal drip. His tonsils were 2 to 3 plus. He had a normal palate. It wasn't high arched, and he was not a mouth breather. He did have acanthosis nigricans on his neck. I graded it as a stage 2 because it went all the way around, but it was light. It was darker in his axilla, and he did have it present on his hand and under his pannus on exam. He did have lipomastia in his chest. He had mild scoliosis, some out-toeing and flat feet, and he was tanner too and already had axillary hair. Now to the labs, as I discussed, I was surprised his A1C was 5.9. Dad was a diabetic, so he wasn't surprised. And his vitamin D was extremely low at 16. Okay, so this is where we're going to talk about what you would write down on your chart. I want somebody, some brave soul, to tell me, list what you would write down as your diagnosis or put on your billing sheet at the end of his visit. Now this is cheating because I didn't have these labs, but tell me what your diagnosis would be. Who wants to open up? Anybody, Miranda? Then I'm calling on you. I think
you're scaring them.
I'm scaring them? Why? I don't want to scare them. Why? What would you write down? Give me 2 things you would write down on your problem list, Miranda.
Prediabetes.
Okay, prediabetes. Let's say you didn't have the labs.
I was gonna say, I would do acanthosis nigricans if I didn't have labs.
Right. So I did. Well, my diagnosis was acanthosis nigricans, and I also wrote down rapid weight gain because 37 pounds in 2 years, that's rapid. Let's not forget about the differential diagnosis, right? So the difference.
Which I have a question real quick about that. So did he not see the PCP for 2 years, or did the PCP? So he hadn't seen the PCP in 2 years.
He had a sports physical by like an agency in Logan. So his checkup for that year was his sports physical, okay, which is why a PCP is priceless, right?
Mm-hmm.
Yeah, yes. Okay. So he had a sports physical, but he had not seen his PCP. It was in an outside place. So I did write down acanthosis nigricans. I did write down rapid weight gain. And what we're going to talk about, if we have time before, because you still want to stop at 30.
We're not. No, I'm not going to. Just keep going. It's okay. You're fine.
So
you said something about differential diagnosis.
Right. I wrote down the rapid weight gain and the acanthosis. So the acanthosis, the differential diagnosis, is anything along the insulin resistance spectrum, which starts with insulin resistance, then goes to abnormal labs, which is usually elevated triglycerides, low HDL, often associated with a low vitamin D, and looks at all those risk factors for metabolic syndrome. He did not meet metabolic syndrome, So his diagnosis then would be prediabetes with hypertriglyceridemia, and that all is under that insulin resistance diagnosis. With females, we also look for PCOS, which is also associated with on the insulin resistance spectrum. The next step up is prediabetes, and then it's diabetes. And as you know, that depends on your fasting blood sugar and your hemoglobin A1C. So anything between 5.7 and 6.4 is prediabetes. Were you going to ask something, Miranda?
Well, I was going to say his HDL is low as well, isn't it? I can't remember what the cutoff is.
Yeah, for a 12-year-old, they really want it to be above 40.
Okay,
Yeah,
good. And then vitamin D deficiency would be another.
Definitely. Vitamin D, low vitamin D level would be 30, and his is 16. We really would like to see a goal around 50 in our patients who suffer from obesity. Okay. So if you were like me and you had to do a differential diagnosis on the first visit, you didn't have his labs, the differential diagnosis, and almost always, is usually exogenous obesity caused by external factors associated with what we eat and our activity. And by far, that's the most common. However, remember that even though with exogenous obesity, our first line treatment is 5210, our first line treatment is 5210, and we focus on nutrition and physical activity, we have to be careful that we don't blame them for this, and that we frame this conversation along the lines of insulin resistance and along the lines of metabolism. And in the beginning of my career, I didn't really talk about metabolism much. But it seems like that metabolism is the one thing that they know about that I can talk about. So when I talk about acanthosis nigricans and insulin resistance, I can talk about that they have a slow metabolism and make that analogy to a car, maybe even a bigger car that has not so good gas mileage. And we'll talk about that next. Back to the differential diagnosis of rapid weight gain. So almost always exogenous obesity is at the top of the list. The other things that I want you to think about, especially with this case with the hyperphagia, I mean, remember, the big thing that they talked about is that him being the garbage disposal. That's not normal. He was always hungry. He could finish 2 of his plates and be eating the scraps from the parents' plates on the way to the kitchen. That I want you to think about specifically, that's associated with insulin resistance, with leptin resistance, and with all of the genetic diseases that are associated with the hunger pathway along the MC4O pathway. And we are going to do one echo specifically for genetic obesity, but I think that needs to move up our differential now that we know more about that. As far as endocrine, for him, it was actually low on my list, even though prediabetes is an endocrine diagnosis. I'm thinking about things like growth hormone deficiency, Cushing's disease, hypothyroidism, and I could immediately rule those out without doing labs, which you notice I did not do a TSH and T4, and that's because his height was at the 97th percentile, and his growth chart for his height was perfect. So I was comfortable enough with him, especially being early in puberty, since he was 10 or 2, not to do any of those endocrine labs. Okay, and I'll open it up to questions before I go into how we treated it. So anybody have a question, raise your hand, and I can answer those. Anybody, Miranda?
Nope, no questions.
Okay, so we're going to follow the 5210 clinical protocol, and we're going to get out that 5210. And I have 5210 on my wall, and I say, I'm going to go out and print his labs. What I want you all to talk about while I'm gone is I want you to think, if you guys were going to make a change and we were going to have a challenge between this visit and the next visit, what do you think would be the easiest thing for you to work on? So I want you all to talk about that and what you think you can do while I go print his labs. So I walk out the door, I go do my stuff, and I come back. And they didn't really agree on what it would be, because Mom wanted to work on the fast food right away, The patient and the dad weren't so thrilled about that. Dad wanted him to exercise, and he didn't want to do that because he exercises when it's football and it's not football. So he didn't understand why Dad was worried, because he exercises when it's football and during football season. So he really shouldn't have to do that other times. He never has. So it was really funny. And then I said, well, guys, what about the easiest thing? And Mom said, well, really, the easiest thing probably would be the drinks. And I said, really? And she said, yeah, because I had gone over some additional stuff with them about insulin resistance. I didn't know his hemoglobin A1C at that point, but that came up when I showed him about the acanthosis. And I pointed that out when I did my exam. And within 2 seconds, both the parents were at my side. So I'm examining the patient, and I have Dad on my right and Mom on my left. I mean, they wanted to know what that was about and ask right away, does he have diabetes? Oh my gosh, does he have the diabetes? That's my worst nightmare. Does he have diabetes? So I had already gone over that a little bit. So they did agree to work on water, on drinking more water. So I went over with them at this visit, the benefits of water. I provided them a handout. I went over label reading. I had some sodas, Gatorade, and some examples in my office. So we practiced reading labels with the drinks. I asked him, did he want to cut back or did he want to go cold turkey? And I was really surprised because he was really kind of laid back. I didn't see the anxious side of him that the parents told me about. And he said, no, I'm going to do it. If I'm going to do it, I'm going to do it right. I kind of went along with his personality. So he said, so as soon as he walks out the door, anything he drinks has to have 0 sugars. He first looks at it to see if it has 0 sugars. If he has 0 sugars, he can have it. If it doesn't have 0 sugars, he says, no, thank you. Dad was going to buy him a water bottle. So anywhere he went and at games, he would have a water bottle that he would take his own water with him. That was what Dad was going to do. Mom was going to buy only sugar-free drinks for home, and she was going to trade in the cans of soda for bottles of water and make sure there were always bottles of water in the refrigerator. Mom also wanted to buy whole grain products and try the bread again. And I said, that's fine if you want to do that. I'm not going to write that down as your goal because I really want you and your son and your family to focus on drinking water and sugar-free drinks for this visit. I did talk about maybe doing some Wendy's makeover. And instead of getting the burger and a large fry, he's already going to do the Coke. He wasn't too interested in that, so I didn't make it a goal. So I told him that I really thought he was motivated, and I thought we should make one additional goal. And the goal that I asked him if he would be willing to do would be if he would be willing to eat breakfast in the morning, because one of the reasons that I thought that he was hungry was because he was skipping breakfast. And that if we would fill his gas tank up in the morning with some protein, maybe that would help. I also told him that protein in the morning would help him build muscle and be better at football. And that really sparked his interest. And he was all in from that. So his 2 goals when he left were to drink 5 cups of plain water a day, number 1, record that on his goal tracker and bring it back to the office for an incentive. Goal number 2 was that any drink that he would drink or think about drinking, he needed to look at the label and make sure it had 0 sugar, 0 added sugar on it. And then the 3rd is that he was going to eat breakfast, lunch, and dinner. So those were his 3 goals when he left my office. Okay. So.
Okay, so I have a question.
Okay, and ask questions.
As PCPs, so how many goals do you think that they should make when they're working with the patient?
1. Okay. And are you asking Dr. Jeffrey, why'd you do 3? Well, 1 and 2 are about the same. It's all related to sugar drinks. And I thought they were highly motivated. They came on their own. And I just really thought they were ready to do 2. As a matter of fact, I gave them my I want you to focus on these two things, drinking water and eating 3 meals a day. I don't want you to go all crazy because it's going to be too hard and you're not going to be able to keep it up. And Mom said that's exactly what's happened in the past. Anytime I've tried to do anything, that's exactly what's happened. We try to do too much too fast and we can't keep it up. We can't last longer than a week. And I said, so then are you going to be able to focus on these two things and not talk about anything else? And she said, well, can I buy whole grain bread? And I said, sure you can. But I was really worried. It was almost like they were too motivated. They were like the horse in the gate, ready to jump out. So I also really talked to them about this is a marathon, not a sprint. You've done the sprint before, it didn't work. It's time to do the marathon and try it my way. So that's what we did. So if there are no other questions, that was great, Miranda. If there are no other questions, then I'm going to go through and I'm going to show you, I'm going to go through how I talk to families about insulin resistance. So on the first visit, when I don't have labs and I'm just talking to them about it, first I have two tools I use in my office. I have a big blob of fat that's 5 pounds and a big blob of muscle that's 15 pounds, and they set out in my office. And when I first talk about it, I talk about this is adipose tissue. That's kind of the fatty tissue that's in your belly. And when I talk about fat, I'm talking about this right here as an organ. I also use my door to my office that is like a wooden door. So it's kind of variegated like muscle is, and it has a handle on it. Those are the two tools I use in my office to talk about insulin resistance, plus the diagram I'm going to show you next. So on the initial visit, or if I can tell the family's overwhelmed, which I often tend to overwhelm my family, so I'm trying to be more cognizant of that, I'll talk about, I want you to understand what insulin resistance is. I want you to think about your body like a car. And I want you to look out my window and I want you to see that there's all different color, shapes, and sizes of cars, and they all get different gas mileage. And that's like our bodies are. Your body doesn't use food like the kid sitting next to you in your class. And you happen to be like the big truck out there that's blue, beautiful color of blue, just like your beautiful blue eyes, but you need more gas and you're hungrier and you need more gas. And then I ask them, what is it that you put in your body to make it go? And they usually will say food or whatever. And we talk about that it's food and drinks. And then I tell them that your body has insulin resistance. Insulin is an energy hormone. I know you probably don't know about insulin, but I want you to, because insulin is what's causing you to gain weight faster than you should. Your body and muscles are resistant to insulin. So you're not getting any gas in your gas tank. And what's happening is your insulin is storing that gas for later in the form of fat, because insulin happens to be the energy hormone. It either gets your food into your muscle right away and uses that gas right away, or it stores it as later as fat. The problem is that as long as you continue filling up your gas tank with food like you do because you're hungry all the time, so I don't blame you for doing that, then your insulin level stays high and you just keep storing fat and you're never burning it off. So what I want to do is to give you better gas mileage, and we're going to talk about how to do that. So believe it or not, that's the short answer. But essentially, your body or muscles are resistant to insulin, so your muscle can't use your food or sugar as gas. So insulin acts as the fat storage hormones and stores it as fat. One important thing about how insulin works is it stores it as visceral fat. And visceral fat is the metabolically active organ that's from here to here. So under your chin to the bottom of your waist. So you'll notice that when you gain weight, you gain it in your chin and face, and the back of your neck, in your chest, whether you're a boy or a girl, and in your belly. And that's how I know from this darkness on your neck and from where you carry your weight that you have insulin resistance. Usually at the second visit, when they come back and I have their labs, I didn't do this on the first visit with them, then I go over my diagram. And here's the diagram. Oh, I'm going backwards.
Yeah, you're
fine.
going backwards.
Okay.
There you
So this is insulin resistance. So I'm just going to talk you all through it like I talk a patient through it. And I'm really sorry for the people that don't have the slide to see this. If they listen to a podcast or whatever, but somehow maybe we can post that,
go. Yeah,
Miranda.
we'll have it accessible so they can click on it.
So first of all, let's get oriented. There's two scenarios. The one on the left, which is what your body's supposed to do, and that's a normal gas mileage, and the one on the right, which is insulin resistance, which is slow gas mileage or slow metabolism. So at the bottom of the screen is inside your cell. That's inside your muscle cell. The red blotchy part is your blood. I want you to look at this cell door in the middle, and I want you to think about that like the door to your gas tank. And this gas tank door has to open. You put in the nozzle and you put gas in your car. So the blue dots, and don't say blue balls. It took me a while to wonder why the boys were laughing when I said blue balls. So say blue dots. The blue dots is your sugar, which is your energy. You open up your gas tank, you put in the nozzle, you put gas in your car. This is what's supposed to happen. It happens in this order. You eat, your food your digestive tract breaks down your food from your mouth to your feeding tube, esophagus, into your stomach, and it breaks it down into small, from macronutrients to micronutrients. So this is your glucose, which is your sugar. When your sugar hits the bloodstream, it makes your pancreas secrete insulin because insulin is the energy hormone. Insulin acts as a key and unlocks that cell door, opens it up, and allows the sugar to go in the muscle. Now your muscle is full of sugar and ready to be active, just like your car tank is full of gas. That's what's supposed to happen. Now let's go to the right side that is insulin resistant. And the same thing is going to happen. We're going to eat, our body's going to digest it. The sugar or the blue dot is going to hit the bloodstream. Then our pancreas is going to secrete insulin. Insulin is the key that opens the cell door. And I want you to see here, I take a pen and I mark out the first insulin. That insulin didn't work. Here's the second insulin. That insulin didn't work. The third insulin, that insulin didn't work. Finally, the fourth insulin opens up the cell door. Now, I want you to look at something here. When we have normal gas mileage, we use one insulin. When you have slow gas mileage, it takes 4 insulins. That high insulin is what's causing that darkness on your neck and on your hands. Okay? And tell me what's different about both of these insulin and how it works. And they pretty quickly see that the picture on the left, the door is wide open. The picture on the right, not so open. So you can't get much sugar into your muscle because the door is not very open. And then I say to the parents, now look at all the energy that the kid sitting next to him has. 1, 2, 3, 4, 5, 6. And look at him. He has 1. No wonder he doesn't want to practice football when it's not football season. He doesn't have any energy. And I can't tell you how many times either the parents cry or the light bulb goes off because they do blame their kids for being lazy and inactive. And this helps them understand that that is part of this disease of insulin resistance. Okay? All right, Miranda, what did I forget? And what questions do you all have?
I don't have any questions.
Okay.
I don't think you forgot anything. I love the example of the car because I think people can relate to that.
Yeah.
And I think it's good to give patients a visual to help them understand the concepts and the door. I think it's always best when you can give patients a visual to be able to picture.
this one is complicated, and one of the things that I did because my beloved colleague, I won't say who it is, but she's on this call. When she first started working for Keys for Healthy Kids, she observed me doing new patients and advised me that, you might want not to go over that diagram the first time you see them. I think it goes over their heads. So I've been doing the short version on the first visit and the long version on the second visit. But I really do think it hones home. Number one, this is not your fault and this is not your kid's fault. This is a metabolic disease. that has led to abnormal weight gain, but the problem is the insulin resistance, and the problem is what the insulin is doing in your body. So now everything that we work on and the goals we make, we do that to lower our insulin level and to keep it low. And if you say it in those ways, they get it. They understand. I have to watch how much sugar that I eat at one time, because if I drink a sugary drink, right? And this is my favorite thing to go over with them. And we look at this diagram and I say, if I eat an apple has sugar and fiber in it, and my blood sugar goes up slow and steady. So I do have 3 sugars there, and I only have 3, and it doesn't go up real fast because the fiber in the apple slows it down. However, if I drink apple juice, my sugar goes up fast. I'm drinking it. It's a fast process. There's added sugar in the apple juice, which gives us 10 blue dots here and not 3. And there's no fiber in it to slow it down. So if my sugar goes up fast, my insulin's going to go up faster, whereas my body's going to get my sugar back down to normal in 3 hours, which is why we do a 3-hour glucose tolerance test. How long do you think it takes to get the insulin back down to normal after drinking 1 apple juice? I'm going to stop and let people either unmute, which I doubt they're going to do that since nobody's unmuted so far, or put it in the chat box. How long does it take insulin to come back down to normal after drinking 1 sugary drink, whether that's apple juice or soda or whatever? Let me see the chat box. Go on fire. Go. How long?
Anybody want to take a guess?
Some brave soul take a guess. Do I hear 3 days? It takes 3 hours.
We have a
3
guess.
days would be perfect. Oh, Rachel said a week. Rachel Day. That's no fair. She knows the answer. It actually is 7 to 10 days. So that's why when you have insulin resistance, you can't cheat. First of all, I hate cheat days. You can't cheat and have 1 soda a week, because that's just going to keep your insulin level high for that whole week. That's how powerful insulin resistance is. Okay. All right. Miranda, you want to ask her any questions, and I'll go on to case 2.
Well, I don't think we're going to have time to go on to case 2. Actually, I think, do you just have the follow-up on this patient?
Oh, okay. We could do that.
Yeah, I think because of time, let's do the follow-up on this patient, and then we can open it up for any other questions. Because yeah,
Okay.
We don't have much time left.
Okay. So I will tell you what happened in real time. Remember, when I saw this patient, I didn't have the hemoglobin A1C. So it took me about 2 weeks, unfortunately, to get the hold of the allergist office, the PCP, order the labs, him to get the labs, and I called him with the labs. Okay. So in that 2-week time when I called for the labs, I called mom and to go over the labs. And I said, before I go over the labs, I just want to ask how he's doing. She said, oh my gosh, he is doing great. He is marking his goal tracker every day. I don't even have to tell him. He is so motivated. I can't believe it. We don't know who this kid is because we've been trying forever to get him to do stuff. He's drinking 8 to 10 glasses of water a day, not hardly even drinking any sugar-free drinks because you told him that water was the best and his body didn't have to work to do it. So he listened to what you said. He's reading every label, even for food. And I know you said not to do that, but we really have been trying to just focus on the water. He has been eating breakfast. That has actually been harder than the water. And one of the biggest differences is that I can't believe the difference in his hunger. It has been so much better. And the only time we really struggle is after dinner and not all the time. So that was kind of his follow-up. We did, after his labs, see how he did for his first visit, and he did do better. I am going to show you his growth chart. This was the last time I saw him. This never happens, by the way. This is his growth chart. Can you guys see that?
Yes.
Now, I only show them the height and the BMI. I don't show them the weight because it's not about weight. It is about habits. That's why I ask you about your 5210 goals and your habits first. We always look at their height first, and I say, just like always, your height is following right along the 95th percentile perfectly. I look at your growth, and if you want to look to see what happened, his BMI stayed exactly the same for 4 visits in a row, and they got very discouraged. We had decided at that first visit on the phone, because he was doing so well, we were not going to add metformin. And at the 4th visit, they said they were meeting all their goals. They were doing everything right. So at the 4th visit, we added metformin, 500 milligrams of long-acting metformin. We added it at night, because that's when he took his allergy medicine. And this is what happened after that. The other thing that we did is that Rachel Day did carb counting with them. Most families can't handle carb counting, but he could. And the biggest problem with him kept on being his snacks, because he just wanted to come home and snack on something, and it was usually a cracker. Mom was no longer buying chips. So one of the things that Rachel told Mom is that every time he has a snack, it has to include a fiber and a protein. So she made a list and gave a handout of examples of snacks that had both a fiber and a protein in them. So what Mom did is she went home, she bought a shoe organizer off Amazon, hung it on the back of the pantry door, made half of them one color, the other half another color. I wish I could remember the colors. I think fiber was green and protein was some blue. And she told him that when he got a snack, he needed to have 1 fiber, which was green, and 1 blue. And she filled things full of fibers and proteins on that hanging shoe thing. And now she didn't do anything. He picked his own snacks, and he always got a fiber and a protein. So with him doing that, controlling his carbs and balancing, drinking all sugar-free drinks, and metformin, this was how he was doing, and he did great. So
Awesome.
yeah, I mean,
And as you can see, this
really
family
good.
was really motivated, which really helps when the families make the change. I mean, that's really a lot of it, but
But
that's
I will point out, as motivated as they are, he was on his way to diabetes. And even when they did make a lot of changes, his BMI stabilized but didn't go down. And that's often what happens. And I always set that stage. I even tell families sometimes it goes up first when we first start trying to work on it. This again is a marathon. And they got really frustrated because they had done so well. So I just always went back to, now, what did we talk about? We talked about this is the marathon. It took him since the age of 8, 9, 10, 11, 12, 4 years to gain this weight. You got to give me more than 4 visits. Right?
point.
Yeah.
Yeah, so that was really good. And I think, we've talked about this multiple times, but really just meeting patients where they are and figuring out what they can work on and how we can make it easier for them. That's, our ultimate goal is, helping them, and not to make it overwhelming, but to meet them where they are and help them to make lasting changes. So, all right. Well, thank you, everybody. We're going to go ahead and close it out. So I'm going to close it with our song. I have to start over. All right.
5210. Every kid, every day. Let's have fun the healthy way. 1, 2, 3, 4, 5 servings of fruit and veggies are great to eat. 1, 2 hours of playtime or less on our screens is more than plenty. And let's go play outside. 1 hour! Tiger it, my turn to hide. And 0 sugary drinks. Yeah, that's the healthy way to think. Every kid, every day, let's have fun the healthy way. Every kid, every day, let's have fun the healthy way. 5, 2, 1, 0.
Thank you, everyone. Don't forget to do the evaluation link. Have a good day.